Paul, first to you. As a nation, we've done so brilliantly, to be honest, in terms of the health and other responses, but now a major setback, a 6-week returned lockdown for Melbourne and the Mitchell Shire.
Well, this is the most dangerous and precarious moment that Australia's experienced in this pandemic since the start of the year, Kieran. The fact that the New South Wales-Victorian border has been closed for the first time in the crisis testifies to that. The breakout in Victoria is much worse than people anticipated or thought a week or 10 days ago. The comments from Daniel Andrews made this very clear, warning that unless this lockdown was put in place now, the risk was that this infection would run into hundreds and thousands. He warned that Victoria was right on the cusp. He stressed that there had been complacency in the community, which of course is a reflection on his own government. I mean, clearly what we've seen here is a series of mistakes made by the Andrews government, not just a question of community complacency. And this then feeds into the economic situation. The government is bringing down its announcement on the 23rd of this month about what happens to job seeker and job keeper after September. And there's no doubt the situation in Victoria, the deterioration of the health situation in Victoria will affect those economic decisions. This is a really significant setback for the Morrison government in terms of starting up the Australian economy. We've got now a really serious crisis in Victoria, the second largest state in terms of the economy. It's going to have national ramifications for the budget, and it will have national ramifications in terms of economic confidence and the investment community.
Peter Hartcher, that's that point that Paul makes is so timely in the sense of what Josh Frydenberg's working on, his July 23 statement, and today I'm reflecting on the fact that Melbourne-Sydney air route, I think, is the busiest in the world in terms of the number of flights between those two cities. So emblematic of what is such an economic powerhouse and going to be shut down for 6 weeks.
Yeah, that's right. And once again, we see demonstrated the fact that there's not a trade-off between good health outcomes and economic recovery. They are part of the continuum, and it's a continuum of confidence. And it's only when the health outcomes are good and sustained that you get any economic confidence to allow things like flights to resume, but all the other economic activities as well. So you get the worst of both worlds. We now have people dying in Victoria, worsening health outcomes, and another economic interruption. So all the politicians who spent the last couple of months banging on every day from their epidemiological expertise, demanding that the economy, quote, reopen, unquote. This is not the question. It's not an open and shut question of reopening the economy. It's the conditions under which you do it. It's the new arrangements that Australia has to impose and get used to. I note yesterday, the current state of the Commonwealth Health advice on the question of masks is wear one if it makes you feel comfortable, as if it's a fashion statement or a personal comfort question. This seems to me like a pretty bumbling advice in a case where we have an international pandemic that is still rising. This is still the early phase of the global pandemic, Kieran. We're going to have to get used to new living arrangements and organisational systems for years to come. And Victoria is a reinforcement of that. And I just add one final thought on that, Kieran, which is that although some of the factors we see in Victoria are Victoria-specific, for example, the bungling of the hotel quarantine system looks like it was pretty spectacular. The general underlying problem, I'd suggest, is the same right across the country. You heard Daniel Andrews talk about a sense of complacency. Well, I think we see that right across the country, and any city, any town could be Melbourne tomorrow.
Yeah, exactly. And I guess that Paul Kelly, that's one of the other components I think that governments have to be very much attuned to, and that is the mental health component, the anxiety that Melburnians, the Victorians are going to be feeling right now, because we all know how difficult those lockdowns were and the huge change to lives and not just business, but people's, schooling of their kids and whatever else. This has a massive societal impact, Paul.
Well, it's a triple crisis. It's a crisis in terms of the infection, it's an economic crisis, and it's a psychological crisis. And you're certainly right about the mental health ramifications. They're going to be very extensive. But essentially, there are two really imperative objectives that have got to be achieved now, Kieran. The first is that this 6-week lockdown in the Melbourne metropolitan areas must succeed. This must be successful in terms of containing and then turning down the infections. This is absolutely critical. And secondly, we need to ensure that the rest of the country continues to perform and we don't have outbreaks in the rest of the country, either as a result of mistakes made there or as a result of extensions from Melbourne. So that means ensuring that the infections don't rise in regional Victoria, and above all ensuring that the main state, New South Wales, the key economic state, continues to perform well. If there was some deterioration in New South Wales, then the entire country is going to be in terrible problems. And the reason this is important is we want to ensure that we don't have the Queensland Premier deciding that she wants to keep the Queensland-New South Wales border closed. We've got to try and ensure that the rest of the country continues to perform.
Yep, indeed. And Peter Hartcher, finally to you. For Josh Frydenberg, he already knew he was facing an enormous challenge on July 23, but it's got a whole lot worse in terms of how he tries to navigate his way through this diabolical scenario.
Yeah, that's right. So obviously the health situation is the first order priority, the economic condition is the second order priority, and then the third order knock-on effect from that is exactly this. It's the fiscal question. How many more billions of dollars and for how much longer does the Commonwealth need to offer income support and other welfare support to people whose livelihoods are either suspended or newly interrupted? This complicates every decision, including Josh Frydenberg's decision about about how to taper that support off, which parts of the country, which sectors of the economy, for how long. So again, to state the obvious, this is the worst of all possible worlds. And Frydenberg, if this continues, will have to go back and reconsider the decisions that they're, I gather, they've pretty well already made. They're going to have to revisit them if the situation continues to deteriorate.
Peter Hartcher, Paul Kelly, gentlemen, thank you very much for that on this developing news. Appreciate it.
Pleasure.